I hear a lot of questions about what the difference may be between neuromodulators like Botox versus fillers. Hi, I'm Dr. Peter Lee, a board certified plastic surgeon at Way Plastic Surgery, the world's leading clinic. So today we're going to be talking about the difference between neuromodulators and fillers. What specifically are we using it for and how they actually work? So what are neuromodulators? Neuromodulators are basically medication that we're injecting into the skin and actually into superficial muscles of expression that we use specifically for wrinkles and lines, such as corrugators, the glabellar lines, the crow's feet around the eyes, or the forehead wrinkles. I mean, these are kind of the basic, what we call three areas of expression that we commonly target to kind of reduce the wrinkles in that region. Neuromodulators have many different brands, and probably the most common that you have heard about are Botox. However, there are different types of brands such as Dysport, Jeuveau, Xeomin, and they pretty much are very similar. However, there's a little bit of difference between them. Besides the three areas of expression, we also inject neuromodulators to different areas for specifically different reasons. So for people with what we call brow ptosis, which means sagginess of the eyes because the eyebrow has descended down, we can actually use the neuromodulators to actually elevate the eyebrow, which really kind of like enhances the sagginess of the eyes. We can also use the neuromodulators to reduce the bulkiness of the muscle as well. So for people with what we call TMJs, where they grind their teeth, and a lot of times their masseter muscles are really tight, or for aesthetic reasons, because they feel like their lower part of the face is too wide because of the thickness of the masseter muscles, you can actually inject these neuromodulators to kind of shrink the bulk of the muscle and therefore slenderize that region. We also use off-label in different places as well in the body, such as what we call the trapezius area, which kind of slenderizes the neck to shoulder line. We can also inject it into the calf region for people who feel like their calves are too big. We also use neuromodulators now to also help with a little bit of lifting of the skin, especially at the jawline. And we call this meso neuromodulators. So brand name, sometimes we use it as meso Botox, sometimes we use it as meso Dysport. And so what we're doing is that we're injecting dilute, minute amount of these neuromodulators into the skin itself, not actually into the muscle. And the skin itself also has what we call smooth muscles. So if you actually kind of weaken that, you can also kind of give it a little bit of a lift. These neuromodulators are medications. So when we inject it into the affected area, it has therapeutic effect in that area for about maybe 3 to 6 months. We also use neuromodulators for migraine headaches. For some people, the migraine headaches occurs because of constriction and spasm along certain areas of the face, specifically around the crow's feet, around the corrugators, and in some patients around what we call the occipital region, which is kind of behind the ear as well. So we inject neuromodulators in that area, and by kind of relaxing the muscle in that region, it reduces the constriction of these nerves. We also use neuromodulators for hyperhidrosis, which means excessive sweating. So a lot of times for people with excessive sweating, especially underneath the arm, or sometimes actually in the hand themselves, we can inject neuromodulators directly into those regions. And what it does is that it reduces the muscle spasm along the areas of the sweat glands, and it reduces the amount of sweating that occurs there. What are dermal fillers? Dermal fillers are exactly that. These are products that fills certain areas. And although that we are injecting it into areas that are usually lacking volume, it doesn't just fill in the areas for volume loss. We can also use it to lift sagginess of soft tissue. We can also use it to increase the definition and structure of certain areas, for example, like the nose and the chin. As we get older, we lose volume in our face. So it's always a combination of sagginess of soft tissue as well as loss of volume in our soft tissue. So a lot of times the areas that we are filling are areas like the temple region, the cheek region, the submalar region, the deepening of the nasolabial fold, also what we call the marionette line, which is at the corner of the mouth. And when tissues sag, we lose that sharp, nice definition of the jawline. And there's always a disconnect between the chin and the jaw region. So we can inject fillers right in that area to kind of like give more straightness to the jawline definition. One of the things that also happens as we get older, and some people think that filling the lips is for young people, that we're trying to like make the lip more kind of luscious and vibrant. But it also is very important for anti-aging purposes as well, because as we get older, our lips become thinner, and especially the distance between our nose and the upper lip becomes longer. And that's a true sign of age. So when we actually fill the lips, it really kind of like makes that entire kind of that mid-face region much more youthful. How can we decide what's right for you? Neuromodulator are medications that reduces the activity of muscles. And therefore, what it does is that it reduces the depth of wrinkles around certain areas of expression, like around the crow's feet, around the corrugator region, around the forehead specifically. For fillers, they really are designed to fill in lines and add volume to certain areas. And therefore, for most people, they do require a combination of both. And most of our patients are on neuromodulators and fillers. These really are kind of the first line of treatment for anti-aging purposes for most people. Whenever we're talking about non-surgical options especially for rejuvenation, a lot of times you do need a combination of treatments like neuromodulators and fillers together to give a more of a natural, rejuvenated look. So if you're new to aesthetic treatments and you're considering neuromodulators, fillers, or both, it really is so important to have an in-depth consultation with your provider. If you would like to know more information about these type of treatments, please visit worldsleadingclinics.com.